Periods are natural, conversation around them should be too. This Menstrual Hygiene Day, Radio City and Team Alembic, the makers of Krina NCR, invite you to join an open discussion on menstrual health, hygiene, and understanding your body better.
Hello and welcome to the Period Talks with Expert. This is a special podcast series we're talking openly and honestly about menstrual health and hygiene. I'm your host Rituparna. ଆଉ ଆଜି ଆମ ସାଙ୍ଗରେ ଅଛନ୍ତି Dr Sujata Kar. ତାଙ୍କ ସାଙ୍ଗରେ ଆମେ କଥା ଲାଗିବା about periods. Hello ma'am.
Thank you for having me.
Thank you. Then what is considered as normal periods?
So see, normal period, many girls have this question. The normal period is any period which comes between 21 days and 35 days. Anything which comes earlier or anything which comes later, once in 14 days, 15 days, that is considered abnormal. Then period normal about 6 to 7 days, average is 5 days. But if it goes on for about 7 days, it's okay. And number of pads, maximum maybe 3 or 12 pads. There can be some mild discomfort, but not severe pain. And there should not be clots and all that. Okay, so these are considered as aspects of a normal.
Every woman's cycle is a bit different, and if there are sudden changes, is it something we look after?
Yes, so that is significant. Like you said, somebody might have only 1 day or 2 days bleeding, somebody might have 7 days bleeding, and somebody might have like a dot at 28 days every time. Somebody might have sometimes at 25 days, sometimes at 35%. So that is why every patient who sits in front of us and thinks that they have any abnormality, we always ask them, what is your usual bleeding? Compare your current complaints with your usual bleeding. If it is drastically different, then we will have to investigate. And for all women out there, whatever is your normal cycle you consider, if it is anything significantly different, you must consider.
Now let's talk about menstrual hygiene.
Okay.
Many girls, by their first period, there have been various misconceptions. And recently, the Supreme Court of India has also told about menstrual hygiene. How much is it necessary?
So see, menstrual hygiene is a very, very important part of every girl and female, which they need to learn. Like you said, nobody probably teaches them from the beginning. I wish to think this is something at home, the parent, the elder sister, the elder relatives, they have to teach what is menstrual hygiene. Or at least in school, the health and hygiene discussion is should on even before a girl has started her cycle. But you are right, it usually does not happen. And now, since last couple of years, a lot of importance has been given by the government. And also you may remember they were very important, socially important movies like Padman and all those that promoted this aspect of menstrual hygiene and menstrual health, and the fact that menses need to be talked about every day. Girls and women need to feel free about talking about their menses. Only then they can learn. They will be comfortable.
Yeah.
But yes, menstrual hygiene should be taught very early, and preferably at home and also in school.
That's really an important point.
Yeah.
ଏବେ ଲୋକମାନେ ବହୁତ travel କରୁଛନ୍ତି. Women are traveling a lot because of their work, school and everything. Is it okay traveling while their periods?
Yes. So periods, I would like to tell that periods is a normal body function. Just like you eat, sleep, drink, pass bowel, pass urine, and these are normal body functions. You have a child, pregnancy, all these are normal part. Menstruation is also like normal function. And so most women should be able to do whatever they are capable of doing. But if they are happy, they are comfortable to do, they feel comfortable about doing, whether it is traveling or exercising, working, they should.
Nutrition is very important.
Yeah.
So we should always keep that in our mind during periods.
See, again, this is not, I'd say this is not a very strict aspect. But overall nutrition for women is better. Because they are menstruating, they lose some amount of blood every month. Number one problem. Number two problem, because women's body is not like men. In women's body, there's a massive changes in hormonal status in their body every month. During pregnancy, it is even more massive. So the different type of hormones in the early cycle, during cycle, after cycle, it's very different. So it is normal for women to feel little different. And nutrition, because they lose blood, and that during the time of menses, the body's immunity level will low. So their nutritional status overall should be maintained. Their hemoglobin level instead, iodine level instead, vitamin D levels, protein levels should be good. So they should take care of nutrition all the time. During menses, they should specially look after hydration and like drinking a lot of water, drinking a lot of electrolyte water, all these things, and high protein. I would say these are important needs. But somebody who's healthy, majority of women don't think so much that I'm having my menses, whether I should eat this or I should do that. We should just behave as you feel well. And overall health, you should keep at a good level.
Many women feel tired during the period. So, is it something to focus on? So, if you're feeling
Abnormally tired, very low, could be due to 2 reasons. A, like we just now said, that it could be because of the nutritional deficiency that they have, and which gets aggravated during periods. So they should look into some blood tests and recover whatever nutritional deficiency they have. But many of them feel low and a little bit down also because of the hormonal changes. And that can be looked after by hydration and by meditation, yoga, light stretches, light weights and things like that. If you look after that as well,
that's very practical.
yeah.
And many women have heavy bleeding and thinks this is how periods are. So, how do we consider this is the heavy bleeding?
This is heavy. So like I mentioned earlier about normal period, heavy bleeding is any menses which lasts more than 7 days, wherein you need, in majority of the days, you need more than 4 to 5 pads per day. And if you're passing drops, these are indications that feeding was heavy. And in that case, you must consult a doctor, because if it goes on for a long time, the girl or the woman can become seriously and
So this is related to women uses their bloods and drastically reduces.
yes, and that can lead to iron deficiency, low protein, so many other things.
Okay. What exactly is abnormal uterine bleed?
So, abnormal uterine bleeding is any bleeding which is not like the regular menstrual cycle. So, let us say heavy menstrual cycle is considered abnormal. Very, very scanty, like almost no bleeding. When you go to the needle pad, that's also considered abnormal bleeding. If you bleed for a very long time, long flow, that is if you have intermenstrual, meaning one menses, another menses, in between if you have spotting and bleeding, that is abnormal. If you have postcoital, meaning after intercourse, if there is bleeding, that is also considered. So there are different types of abnormal uterine bleedings, but these are the broad categories.
Many women think visiting doctors, so thinking that it's normal. So when should women should go to doctor?
So any of these abnormalities, if it persists for more than 1 or 2 cycles, then they should investigate. And also it depends on the age group. If you're very young, maybe you can go it for a few a month or 2 or 3. But if you're in the perimenopausal stage, with just around menopause, that is the time when you must definitely visit and do some tests. So certainly any abnormality which lasts more than 1 or 2 cycles should be checked. way.
Apart from all these, what are the most common gynecological concerns women should focus on?
See, there are so many gynecological issues that women have. I think certainly
We should not
ignore. See, maybe number one is any kind of abnormal bleeding that we talked about. All these different categories, they should not ignore. If there is pain, again, pain is another aspect which many girls and women normalize. They feel that pain is a normal part of menses and just buy the tablets and step. If also, to a certain extent, is okay. But if the pain is very severe, lasts for at least throughout the cycle or persists in an hour after period, that should not be ignored because that can be a sign of some major issues. Then if the period cyclicity is not proper, meaning like I told you, it should be 21 to 35 days. If you get period once or 2 months, or 3 months, that should not be ignored because that has to be checked. There are many abnormal hormonal, diseases or syndromes that can cause this. So these are some of the things related to menses which girls should not ignore.
Does regular checkups matter?
I think regular checkups, certainly after a certain age. Of all the regular checkups, pap smear is one of them. And ultrasound is the second one. But regular checkup, I think beyond 30, certainly. Beyond 40, everywhere.
So, doctor, let's do a myth versus fact round.
Okay.
Women should avoid bathing during periods.
Wrong. Absolutely, it's wrong. Myth. They should take, proper bath and maintain hygiene.
Severe period pain is always not right.
It is enough. Severe pain needs to be shown. It can be some serious diseases like endometriosis, adenomyosis. It can hamper their chances of getting pregnant. Right. So they must consult.
Heavy periods are not well and women should tolerate.
No. Should be checked.
Talking about periods openly is inappropriate.
It is very much appropriate. Women should be able to talk about their periods, whether they are in the house with their fathers, brothers, or they are in their offices with their male colleagues or anybody. They should be able to talk openly about it.
Before we wrap up, one message you would like the listeners to remember always, then what should?
I think the last part is very important, meaning normalize menstruation and menstrual health and menstrual hygiene. Normalize it. It is a normal aspect. Like every time we tell today I'm feeling hungry or I am eating this or today I'm having bloating or this, that and the other. People talk about. Similarly, they should be able to talk about that, menstruation overall.
Thank you so much, ma'am, for the insightful session. Thank you so much. And to all our listeners, your health matters, your questions matters, and seeking help is always a sign of strength, not hesitation. This was Menstrual Hygiene Talk with Dr. Sujata. Stay informed, stay healthy, and keep the conversation going. Until next time, take care.